Texas lawmakers are working in this special session to decide what the state will do with unspent federal relief funds from the American Rescue Plan. It's a big chunk of change, $16 billion. And lawmakers are getting a lot of requests from advocacy groups looking to be included in the plan. The list includes healthcare workers and patients who need at-home care. Maggie Glenn explains why advocates for home care and hospice feel overlooked and how much funding they want to give Texans the care they need.
I'm here today because my daughter is sitting in a hospital at Children's Medical Center in Dallas because the private duty nursing situation in Texas is failing her.
Brian Broadbent's 5.5-year-old daughter has a rare genetic disease called Chaser. She depends on a ventilator and needs an at-home nursing attendant, but her family hasn't been able to find one.
We've been trying to hire a nurse for 16 weeks, have not had one single application. And when we went to the hospital last week, we sat in the ER for 21 hours, 12 hours waiting for a room.
All at-home healthcare sectors report staffing shortages right now, from attendants to developmental services like speech therapists.
I've told the mother of a 10-week-old infant who can't swallow that we likely won't be able to see their child for another 4 months.
Unlike hospitals and nursing homes, the home care industry has not received any COVID relief from the state.
We service 7 states in the U.S. right now, and every other state that we're in has provided COVID relief for home care. Texas is the only one that has not.
That's why the Texas Association of Home Care and Hospice is asking the legislature to allocate $412 million of the state's $16 billion in federal COVID relief to these agencies.
With this funding, we can ensure adequate supplies of PPE, and we can offer competitive employment opportunities for nurses and therapists.
And if you can't stand the thought of one of your loved ones having to wait for access for medically necessary care, don't make an exception for one of ours.
We want to take a deeper dive into this issue now with Maggie. That sound from the father was so compelling. You spoke with other families, right?
Right. There were multiple families there at this press conference fighting for at-home healthcare workers. Marcia Bayer spoke to reporters her daughter Hannah needs an at-home health nurse.
Hannah is my youngest of 4 children. I actually have 3 children that qualify for home health. Currently, our family has over 200 hours of home health, and 172 of those are not being met.
So there she was referring to her other 2 sons that weren't at that press conference who also need speech therapists, but they're not able to get that care right now, and they've been applying since January.
Maggie, we've heard about the state using federal disaster funds on medical personnel. Has any of that helped when it comes to home care?
Well, Josh, between July of 2020 and August of this year, the Texas Tribune reports that the state spent more than $5 billion of federal disaster funds and coronavirus relief funds on medical personnel. It came after hospitals and local health officials complained to the governor that the cost to hire contract nurses was skyrocketing because of a statewide staff shortage. The funding helped hospitals, but the competition to find nurses has not helped with this home health providers shortage we're seeing.
What would this temporary funding they're asking for help specifically?
So it would provide some grants for these providers to get PPE so they can still be going into homes safely, with obviously COVID still being top of mind. And it also, while it wouldn't raise their wages, it would make it available for them to offer signing bonuses for these nurses to make it a little bit more competitive and more viable for these workers to decide to go into this field.
What's the long-term solution? Because even if they do find funding, it's not a permanent fix.
Right. So that's what these parents are fighting for in the future. Right now, they're asking for that temporary funding, but in future sessions, they're going to be asking lawmakers to consider raising the pay cap for these workers, because ultimately, that's the only thing that they see will truly solve this shortage is raising those wages.
All right. We'll see what happens in the second half of this special session. Thank you, Maggie.
Thanks, Josh.
Frustrations mounting for Travis County drivers because of a backlog on vehicle titles and registrations.
Every time I went on there and looked, there was nothing available. And I called because I told them my registration's going to expire, I don't know what to do, and they said just keep checking every day.
How the backlog brings the threat of big fees and traffic tickets. Our investigation next on State of Texas.